Hey folks, it's Dr. Sam. Good morning. And I wanted to address a question that I keep getting. Should you do genetic testing if you have macular degeneration? So I want to start with a study that was done in 2001. This is a famous study called the Arid Study, age-related eye disease. And researchers found without a doubt that if you supplement with vitamin C, vitamin E, zinc, beta carotene, and copper, you had a lower risk of developing macular degeneration. In 2006, there was the Arid Study 2, and this was performed by the National Eye Institute, and they found similar things except that they substituted lutein and zeaxanthin for beta carotene because they found that patients who smoked and they supplemented with beta carotene had a higher risk of developing lung cancer. So in terms of genetic testing, there are four main genes that can express to macular degeneration. The first two, CFH and CTG2, researchers have found that if you actually have those genes at high levels and you take supplementation, it can make macular degeneration worse. If you have the genes ARMS2 or CTG3, that it didn't matter if you supplemented with nutrients, that the macular degeneration would actually get better. Now, in terms of other studies that actually refuted this, there was a study done by the National Eye Institute which said it really doesn't matter what your gene expression is, that supplements could help you if you have macular degeneration. And there was another study that was published in the Journal of Ophthalmology which also said that the gene expression didn't matter, that if you supplemented with nutrients, that could also have a positive effect on reducing macular degeneration. So if your CFH is high and you don't want to take supplementation, my recommendation would be to do a gluten-free, dairy-free, sugar-free diet. I also would increase your microbiome in the body, especially the gut. There was an animal study done which found that these animals that were high in CFH, that when they reduced the inflammation in the gut and increased the microbiome, their retinal health actually improved. But I have to say that macular degeneration is a complicated disease. And yes, we do have the genetic influence, but we also have a very strong environmental influence. You know, I've talked about in other videos some of the risk factors that cause macular degeneration: obesity, inflammation in the body, stress, trauma, toxicity, diabetes, hypertension, taking pharmaceutical drugs. So these would be all factors that I would try to reduce even if you have these high gene markers. Because overall, I think in terms of retinal health, if you can improve the oxygenation and hydration in those microcapillaries, you have a lower risk of developing any kinds of retinopathy, including macular degeneration. I would also add do my eye exercises because those actually improve the circulation and lymph flow, they reduce the stress, and they can improve your overall retinal health. So thanks for tuning in today. I really appreciate it. And until next time, see ya.